Hey folks, so I've done a lot of content on Ozempic in the past, and a lot of people are asking me about this story that's in the news cycle about these so-called Ozempic babies. So this is actually a real trend. Let's talk about it. So the chemical name of the drug is semaglutide. That's what's found in Ozempic, or now it's called Wegovy when it's used for weight loss. And we know that it's a very effective weight loss drug, but we also know that it's disproportionately used by young women. So ever since it's been shown to be effective for weight loss, 75% of the prescriptions have been in women, and many of them have been young women. So obviously a population that can get pregnant. Now, many of these women are actually on the birth control pill, but they're still getting pregnant through the birth control pill, and that's a problem. And so there have been studies suggesting that these drugs might actually reduce the body's ability to absorb the birth control pill into the bloodstream. That's been shown more so with another weight loss drug, the molecule being tirzepatide, or marketed as Mounjaro or Zepbound, but also to some extent with Ozempic or semaglutide. So that's one possible mechanism here. The other mechanism, of course, is just increasing fertility. So we know that overweight and obesity has impacts on hormonal cycles and ovulation. And as women lose that weight, their ovulatory cycle becomes more regular and they become more fertile. The final theory is that these drugs might directly affect ovulation. And that actually comes from animal studies, so rat studies that show that GLP-1, which is the hormone that these drugs act through, might actually have an effect that's similar to a hormone called luteinizing hormone, which increases ovulation. And at least in these rat studies, this drug was able to directly increase ovulation and increase offspring. The reality is that right now we know very little about the impact of these drugs in pregnancy. Manufacturers say not to take the drug for at least 2 months before trying to get pregnant. So Ozempic babies are real. If you're on one of these drugs and you don't want to get pregnant, you may not want to fully rely on your birth control pill. You might want to think about other methods of contraception and talk to your doctor.